it is mutant virus or original virus. Our preventive measures do not change. The same thing, the mask, the distancing and the hand hygiene.
Okay, let me bring in the others as well. Dr. Archana Dhawan, come in here. Dr. Archana Dhawan, this is a health emergency in Maharashtra. In Mumbai, it's an SOS. Worrying numbers, rising by the day. What's the solution, Dr. Dhawan? And why has it come to this after a very good start to the year in terms of controlling the outbreak and vaccine rollout? We're now seeing the second wave, particularly in Maharashtra and Mumbai. Why is this and how do we control it?
Well, I think the pandemic was bound to have a second wave. It happened all over the world and it was bound to happen in India itself. The only place where I suppose we've gone wrong is that we've not understood the impact of the second wave, and perhaps we've also not wanted to accept that as a nation we're going to face the second wave as well. So this business, as Dr. Mishra pointed out, there's a lack of intent of social distancing, there is a lack of intent of staying away, and there's a lack of intent of trying to tell people that, okay, I'm COVID positive, I shall restrict myself from meeting people, and accepting that that's the best thing you can do for others. So this, what's happened is, a sort of denial of accepting the natural course of the disease. See, the pandemic had to come in two waves. It came in the UK, it came in the US, it came other parts of the world. Why was it not going to happen to us? How come, if we were God's only nation and God decided not to give us the pandemic for the second wave was not going to happen? So I think it was just possibly our people not willing to accept that it's going to happen. It was there, it was screaming in the face, and we were not willing to accept it. I think biggest default that happened here was this failure of intent of accepting, and partly failure of realizing that if the government is screaming at the top of its face that please maintain distancing, wear masks, use sanitizers, do not mix or mingle unnecessarily, we were not as a population willing to abide by that, and we were not willing to accept that. We perhaps got much more responsibility as citizens than what we were ready to, than what we were ready for. As a citizen of this country, our responsibility should have said, stay away, don't do unnecessary activity, don't have unnecessary festivity, use masks, wash your hands, stay away from people, avoid using public transport if it's not needed, avoid going to places where it was not needed. Perhaps as a nation, we were not prepared for the kind of responsibility that was given on us.
Okay. Dr. Ishwar Gilada, okay, I don't think his audio is through just yet. I will get him back in just a second. Urvashi Kona, let me quickly go back across to you, Urvashi. Okay, I'm being told we've lost Urvashi there, it seems. But let me go back across to Dr. Mishra at this point as well. Dr. Mishra, there's a bit of a concern in Maharashtra because even the hospitals now in Mumbai are beginning to fill up. So as far as the health situation there is concerned, that's also a bit of an emergency that's happened with the rising numbers, the huge spurt in cases. Hospital beds are filling up, which is also now getting a bit alarming for the administration.
I think what we have to enforce home quarantine very strictly. That is something which can prevent panic about hospital beds. Now I know one family in Pune, they were visited by a young girl. She was symptomatic day later, and they also got tested and it came out positive. And then they all got tested, they all came positive. The wife, the lady in the family is a little bit more sick, but the husband is okay, the son is okay. They can very well be treated at home. The one who requires oxygen, and the only indication for hospital oxygen. And once that is there, then you surely go to the hospital, and she is doing well otherwise. So what I'm saying that people must also the responsibility by self-quarantining, and that is something which is very, very important. Here what people are doing, they are coming positive, and not only they are not letting people know about it, they are roaming around and mixing up with people. I think that is what is making Maharashtra and the spread widespread. So I think people have to, and in between what happened, even I would say every electronic media also got a little bit lax, and we stopped discussing actually for almost 2 weeks about COVID when the cases were going down. So that also people felt vaccine coming in, the cases going down, but even they had gone down to some level, it was never below 10,000. At one or two occasions, it was 8,000 or 9,000. Otherwise, 10,000 infective cases were coming daily until it started rising. So, of course, as Madam said, that we are no different. This wave had to come, but then we could have behaved a little more responsibly so that the number of rising cases could be contained. It cannot become, say, 10,000 immediately or 5,000. It will go up, but we don't want that it should go up to 1 lakh, 1.5 lakh by end of May. And if we don't want that, then maybe limited lockdowns in the areas, in the buildings where more people, more families are getting infected, not across board, because we have seen the problems of major lockdowns also, and it was severely criticized because you cannot have both ways. You do lockdown and then you criticize the economy is going down. So you can't win both ways. We have to be pragmatic about it and also create responsible behavior amongst the public with a strict enforcement. If there is no mask, fine, and people must be told about it. If they are traveling in local trains, mask has to be properly placed. If they are going for work, mask has to be. No party. And we are saying that colleges, schools can still be closed for some time, for maybe as you close and open in June. That can still be done. We can make up with extra classes, etc. That's not something which heavens will not fall down if the classes will not take place. I've been telling this for, even if it's a 0 year for large number of students, that's okay. Because still you will save lot of problems having with the infection spreading all across. The good thing is, so far, mortality has not reached the levels we saw in November or October or September 2020. The hospitalizations have just shown some increase, what you are saying, and that is something can be avoided by proper home quarantine, the home consultations by the government, and I think in some period between June and September, October, Delhi government did that, UP government did that, private hospitals came on board for home quarantine, home advices. So all those measures have to be in place again. So we have to go back to 2020 except major lockdowns. Because
okay,
that creates more problems.
Okay, let me bring in Dr. Ishwar Gilada at this point as well. Dr. Gilada, you know, your assessment of the situation in Maharashtra, what can be a solution to the crisis? Is lockdown the only inevitable answer? And where did we go wrong? You know, where did we go wrong? Which is why the second wave has been allowed, to boom in this manner in the country. Dr. Gilada, are you able to hear me, sir? Dr. Ishwar Gilada? Okay, I think there's some problem there. Archana Dhawan, come in here. Archana Dhawan, come in here. Because it's not just Maharashtra. It started in Maharashtra and Mumbai. The cases are still peaking there. They're at their highest level currently. But it's spreading. You know, it's inevitable that it will spread across the country. What sort of measures are needed in other states as well, Dr. Dhawan, where the numbers are not so high, but still there is a threat, and slowly the rise is happening day by day?
Well, the first thing that needs to happen to restrict the spread of the disease is social responsibility. We need to understand that if we have the disease, we have to admit it and we have to quarantine ourselves. You can't be testing COVID positive RT-PCR and be roaming all over the place because you're asymptomatic. So perhaps it's going to be a double-edged combat. We as the people of India have to be more socially responsible, and the healthcare providers and the healthcare system has to come in and get more proactive. I remember the time when COVID just set in. Anybody who at all tested COVID positive was plagued by the government. The DM, the district magistrate called, the DCP called, the healthcare providers called, everybody was all over and active. I think we need to go back to the same level of proactivity, wherein every case needs to be traced. Contact tracing needs to be done yet again, like we did in the first part of the lockdown. And of course, social responsibility, and at the same time, the vaccine drive has to pick up tremendously. I'm sure the school children see a messiah in Dr. Misra, but I think he's very right. We don't really have to open schools. We don't have to open colleges. We could well do them a year later. But of course, I do understand that businesses need to run and financial institutions need to run. But organizations which can be let aside for the moment should be let aside. And the government will have to take in very strict measures to ensure that unnecessary activity, unnecessary movement, unnecessary deployment of people into resources and areas where there is a cohort of people gathering has to stop. So once we do a multifarious activity like this, where people take in their responsibility, the government takes, stern measures like it did at the time of the first lockdown, but a restrictive measure. You can't just shut the whole nation and say we're going to shut everything and contain the disease. We have to be selective. We have to be smart. We have to pick up places and work and sectors and segments where work can be allowed and where work cannot be allowed. And where work is allowed, of course, it has to be allowed with very strict measures, strict SOPs in place, which it's the responsibility of the business owner or the setup or the MNC or whatever it is taking care of the management to ensure that those rules and regulations are followed. If your workers are not well, they stay away. If they test positive, they stay away. If your workers have the access to wearing a double mask, well, they should. If they don't, a single mask is good enough. There should be the facility to have sanitization of hands as and when needed, or they should be instructed, counseled, or trained to go wash their hands every 2 hours. And of course, little measures like providing vitamin C, boosting up immunity, giving information to people who are coming to work might be a little step forward. But definitely more awareness, more stringent measures in certain sectors of society, and picking up the COVID drive, the vaccination drive. I think if you put all of them in place, things should sort out sooner than we expect.
Absolutely, Dr. Bajaj. Stay with us. In fact, let me also, go back to MC Mishra at this point. MC Mishra, now the concern also, of course, is twofold, right? And that's what the Prime Minister emphasized in the last meeting with CMs as well. One is containing the spread, controlling the number of cases, and two is continuing to expand the vaccine rollout as far as possible, so that people, have this at least, immunity or some sort of presence of the vaccine in their body, which can help them fight the disease and can help prevent the further spread. Now that is going to further expand from the 1st of April, as of course everyone over 45, regardless of comorbidities, can begin to take the vaccine. Do you believe that this two-fold strategy must be adopted concurrently of A, controlling the spread, and B, maximizing doses of the vaccine that are administered?
Absolutely. I think there are 2-3 things which can be done, as Madam just outlined. One is we must increase our capacity for rapid point-of-care testing. That is something can be dealt with in malls, in offices, and even vaccination can happen in these places. The other day, our RWA brought the vaccine in the locality, and those who opted, they got the vaccine in the locality. So we have to do all this, and we, like today, we look at 300,000 vaccination centers. We can easily ramp them up by 500,000, 600,000 by making these small places where it can be easily taken. And now once the vaccine is in the private sector, so it shouldn't be a problem. One can tie up in their locality with the hospitals, and they're very willing to help in this on a very meager payment of 250 rupees. And those who do not those who cannot pay or don't want to pay, they can go to a public place, vaccination center, and get that vaccine. It is very easily done. Actually, in most places I have seen, I got myself vaccinated in one hospital, then I am monitoring the vaccination in another hospital where I am attached to, and also I am seeing at AIMS Delhi. So it's a very simple process. And even if you cannot register beforehand, you can go on the spot and you can be taken care, and you won't have to spend a lot of time in standing. And from 1st April now, 45, everyone is allowed, and I'm sure very soon they'll allow 18 plus everyone after getting a stock of the how many doses are there with Serum Institute and Bharat Biotech. Once that is done, I'm sure in the first 2 weeks of April, you will see that everybody will be allowed and they can opt for public or private sector. And if we can cover our population, almost 8 to 10 million people a day, right now it is 2 to 3 million. So if we can ramp that up, I think by June we can cover the population which we were supposed to, like 30 crores by July, August. We can do it by June and then go further and ramp this up. And because this pandemic will be taken care only by developing some sort of a herd immunity. And that will come only when 70 to 80% of population is covered with vaccine. And now in April, I am sure Cadila would be on board, Sputnik will be on board, and also government is considering to give approval to Pfizer, Moderna, whosoever has applied for import, and that would also be there. So I think we'll have a bouquet of vaccines. So the vaccination drive should be ramped up, speeded up, and that is something. And people's behavior, if we cannot ensure behavior, I think that is something which government, if you do a strictness, then you say you are doing, this is my liberty, this is my freedom. And if you are not doing it, then what they are doing, what they did on IIM Ahmedabad campus, the same thing is happening in society at large. So I think some sort of a discipline has to be brought in by our security forces, which they did a commendable job during lockdowns. Now they have to do it again to ensure mask. And once you have a mask, you cannot touch your face. That is something, this is what I have been emphasizing time and again. The mask has a dual advantage. It saves you from pollution. It saves you from virus and bacteria. And in last 1 year, tuberculosis cases have come down because of the so much use of mask. So we must continue this benefit of mask even when COVID has gone. But people must develop this habit of putting on mask. I have seen Japanese putting on mask. When I went 5 years ago, there was no pandemic, nothing, but they were putting on mask while traveling in their local trains. So I think this is something which we can easily do, develop a habit. So whenever we go out of our homes, if our face is not covered, it should look like that we haven't put on clothes. We should feel like that. And that is something will go a long way in containing and controlling this sudden surge which has taken place over last 3 weeks.
Okay, let me try and get Dr. Ishwar Gilada if he can hear me. Can you hear me, sir?
Yeah, thank you.
Yeah, Dr. Ishwar Gilada, how do you react to this spurt, and what's the solution? What's the solution to control the cases and to to sort out the health emergency that Maharashtra and Mumbai are currently facing?
You see, Maharashtra is just showing it, but many other states will follow. If you can just see in last 2 weeks, earlier Maharashtra was reporting 65% of the country's cases. Then it became 60%. Now it has become 58%. So slowly other states are picking up. Secondly, this virus strain is a very different, as has been stated by Dr. Mahesh, that it is a highly infective virus but less lethal. So advantage with this virus is that people will not die and they are not going to be very much critical. But a lot of people will be there, will be infected. And currently the infectivity rate is so high that the case doubling rate is just 13 days, which was never before earlier. So what we are contemplating, that there will be many more cases in next 2 weeks or so. Maharashtra itself will have close to 1 lakh cases. India will have more than 2 lakh cases. So by that logic, we are going to see spurt of cases. Now what has happened in over 1 year is that young people between 20 to 40 or 20 to 45, they have been blamed. Now what we have seen in HIV epidemic, where I have been involved with last almost 3 decades or more, that we made a youth-centric policies. We, rather than blaming youth, we put youth at the center stage of the policy making so that implementation was easier. Now also we need to do that. Make youth responsible, make youth-centric policy of controlling this epidemic or pandemic. And when you say youth are responsible from picking infection from society, bringing to home to their elderly, and back and forth. So why not youth be immunized? There has not been any shortage of vaccine. We just spent a lot of time in planning, and currently also our vaccination pace is very, very low, as has been already emphasized by my two previous speakers. So what we need to do is that if we look at only MBBS doctors in the country, we have 12,70,000 MBBS doctors. We have 3,70,000 postgraduate doctors. So we have 16 lakh qualified people who can be used for vaccination. Even if 20% of them are used, we get 3 lakh people and 3 lakh vaccination centers. And each doctor has 4 or 5 support staff. So we have so many people, and if 100 vaccines are given by one vaccination center, it can be 3 crore per day. So if we are looking at 120 crore or 130 crore to be vaccinated, first dose and second dose, then we can complete this in just 30 or 40 days. If we continue vaccination with the current pace, number one, vaccine is not going to prevent this current surge. It is only to prevent the third surge. So if at all the vaccination prolongs by more than 1 year, we'll have to have second round of vaccination of those people who have been vaccinated. The life of vaccine is only 8 to 10 months. 2.5 months are already over. So we have only 6 months to complete entire vaccination of whatever number of people to be vaccinated. If we look at the number of people to be vaccinated, below 18 population is 41 crore and 2 crore are pregnant women. So 43 crore are not to be vaccinated at all. There are only 90 crore people left. Out of 90 crore, 70% will take vaccine. If you look at the current pace, a lot of people do not take vaccine for whatever vaccine hesitancy is there. So if 70% people take vaccine, we have 63 crore people require vaccine, and 2 doses will require 120 crore. And if we plan properly, 1 crore a day, then we can reach in 120 days. I'm of the opinion that it should be 2 to 3 crore a day, but 1 crore is achievable. Secondly, the current surge has to be contained. Lockdown is not a solution, but it brings the socio-economic impact, psychosocial impact, by which people get fear. Currently, there has been a lot of hesitancy in people. There have been lockdown fatigue. They have already started working, and stopping them is difficult. But what we need to be doing, that when we started Mumbai locals, I told people in government authorities that you allow them to travel only with face shield, not only mask and face shield together. Because in local Mumbai, there cannot be social distancing at all. So if there is a double protection, then 95 to 98% protection is there. Infection could have stopped. We didn't do that. There are buses where they used to keep one seat open, it only for 15-20 days. Thereafter, there is again overcrowding in buses. So whether public places, buses, public transport, they are all overcrowded. We need to have staggered timing. Staggered timing has not yet happened, not even in government offices. We need to have morning 6 o'clock till 2 o'clock, 2 o'clock till 10 o'clock. If you do that way, staggered timing, then a lot of rush can be staggered. That has not happened either in private or in government. So we need to do a lot of things. As Mahesh was telling, we need to look at the East, how they are masking. Even prior to this pandemic started, 40 to 50% people were masked in Vietnam, in Cambodia, in Thailand, in Hong Kong. And for them, reaching from 50% to 100% was a very small thing to do. But for us, we are 0% masking. Now we have reached to 40-50%. But if you look at different type of masks, which are cloth masks, design masks, fashioner masks, they are not protective. There is no nose clip in those masks. So we need to look at the standardization of masks, how they should be worn. And you make youth responsible for their generation, for the next generation, and for the previous generation.